Hello, everybody. I'm Dr. Peter Stotz. I am the chairman of the Vagus Nerve Society. And welcome to our second webinar of the day. The first webinar was on performance enhancement, and it was really great. For those of you who missed it, it will be up on the website, the VN Society website, in the coming days. So take a look out for that. It was really a wonderful presentation by Dr. McKinley. Now, for tonight, I'm absolutely thrilled to be able to turn over the podium to my good friend Navaz Habib. Dr. Habib is a world-renowned a chiropractic physician who has written two of my favorite books that I'm holding up in my hands right here. Not just one, but two of my favorite books on the vagus nerve. He is truly one of the world's experts in understanding the physiology of the vagus nerve, how it impacts both health as well as disease, and is a busy practitioner. And he's going to give us some insights tonight on how to implement vagus nerve stimulation to your clinical practices. With that, I'm going to turn it over to my good friend, Dr. Habib.
Thank you so much, Peter. Thank you for the shout out on the books. I was going to do that myself, but I appreciate you doing that early on. Um, I am very excited today to talk about strategies and how practitioners and healthcare providers can implement Vagus Nerve Society into their clinical practice. We'll go over a little bit on patient selection, specific protocols, and best practices as we go through today. This is the type of webinar, though, that I want to just start off by telling you a little bit about me, the way that I practice, and the kind of process that I use when I'm working through patient protocols and whatnot. So I'm just going to click the right thing here. There we go. So I want to tell you a little bit about my practice first. I am a chiropractic physician. That's where I've done my training at CMCC here in Toronto. I am Canadian and it is dark and cold here right now. I am acupuncture certified in traditional acupuncture training as part of my chiropractic training. And I completed certification in functional medicine through IFM and FMU, Functional Medicine University, and the Institute for Functional Medicine. It was through this journey that actually implemented a lot of those protocols into my own health journey that I decided to open up my own clinic, and I founded Health Upgraded, which is an online education and consulting resource with a strong focus on optimal daily habits, sleep, nutrition, gut health, stress management practices, and it all ties together with vagus nerve optimization. Okay. So in my practice, the goal, what we're trying to help people create is health span. Now, health span is to me extending your functional years as long as possible up until the point where we all will eventually pass. I love this image because it talks a little bit about, or it shows how the ideal situation is that we're vital, we're living functionally and optimally as long as humanly possible until we reach the point of maximum life potential, which in theory is around 120 years, and then it's a big drop off and we're gone, right? The unfortunate situation is that today, the health decline is happening far more rapidly. The slope on this curve is way too fast, and people are really suffering. We know that people are experiencing chronic disease at earlier and earlier ages, that younger people are being diagnosed with chronic health conditions. And the goal of what we do at Health Upgraded is to extend out and optimize that curve to help make sure that we can help people live a vital life as long as humanly possible. Okay. So that's really the goal. And there's a really important quote that I think helps to explain how we get this done. And that is by Thomas Edison, that the doctor of the future will give no medicine, but he will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease. I really emphasize this, the cause and prevention of disease, because I think this is where the vagus nerve can be utilized in its best forms. Okay. So this is Thomas Edison's quote, and this is just how I see the world, how I see medicine. We know that the kind of traditional medical system sees all of these diagnoses as we look at a tree, the same way that we see the leaves, we see these diagnoses, we see these Western labels that have been put on. And there's nothing wrong with these labels. The issue is if we simply use those labels as the deciding factor of how we are going to provide medical care, then we're missing a lot of that story. The big part of that story that's missing is these root causes: chronic stress, poor diet, environmental toxins, lack of sleep, poor relationships, nutrient deficiencies, lack of movement, negative mindset, genetic predisposition, trauma, and microbiome dysbiosis, amongst many other potential root causes that cause a lot of these conditions. We know that the roots are strongly connected to what we then see when we're looking at a tree. So it's important to note that there are root causes to every single one of these chronic health conditions, and that's what we at Health Upgraded look to do. We look to dig deeper and try to figure out, was there a specific antecedent or precursor to the symptoms that somebody then started to experience? Was there trauma that was linked to mental health issues? Were there major stressors or diagnoses that happened prior to, or other issues that might have been tied to the production of a health condition? And so noting these root causes and helping to identify what they are really helps the patient to uncover the root cause behind their struggles and empowers them to say, it's not all in my head, that I can do something about this. So this is really how I see this. And in my latest book, Upgrade Your Vagus Nerve, I did go into depth as to how to identify and classify the 4 types of root causes. So I've classified this down into 4 types of stress that cause dysfunction in these areas and are often the root causes that cause a lot of these health conditions to occur. Number 1 are daily stressors. These are our daily habits, challenges that cause us to go into kind of chipping away at us. These are the, eating a little bit later at night or sitting all day at work, the daily stressors that cause us to not be able to optimize our health and actually end up being major stressors. Even things like how we get our kids out of the house. I know that my Aura Ring data shows that I get stressed at 7:45 until 8:15 a.m. every morning as I'm trying to get my kids out of the house. And again, it tends to happen around bedtime. So these daily stressors absolutely apply because they're showing that our heart rate is reacting accordingly, or our health challenges are changing according to these daily habits and stressors that are occurring. The second area is psychological stressors. These are our emotions, and I'm going to dig into each of these a little bit just so each of us can understand what I'm looking at. The third is physical stressors, and this is one that I think is overlooked pretty significantly, and we'll talk a little bit about what to do or how to assess these. And the last is biochemical stressors. These are our environmental stressors. So habits, emotions, movement, and environment. I think we need to assess all of these as being potential sources of stress that can cause dysfunction in the vagus nerve and throughout the entirety of the body. So daily stressors are these habits. A habit is an action that you perform frequently and generally automatically in response to a cue or environmental trigger to experience a reward. They can be productive or destructive, and they're generally driven by dopamine. There's almost like this drive to experience these dopaminergic reactions internally. And daily stressors can often be choices that we've made that have ingrained themselves through neuroplasticity into loops that we tend to get into really easily without consciously thinking about them. So these are things that we need to look into. What are your habits prior to sleep? What are your habits prior to eating? Are you eating in a rush? Are you eating in the car? What's happening with regards to moments where we should be calm, but maybe we're not being as optimal as we should be? The second area is the psychological stressors. These are emotions. And I'd love, if you do know about this, what neuroception is, I'd love for anybody to just type into the chat what they understand neuroception to be, or if they're aware of what it is. I'm not going to take too much time here, but we'll go into what neuroception is here. Neuroception is the constant scanning of our surrounding environment, assessing for danger or threats to our safety. Safety being the key word here, taking place subconsciously outside the realm of our awareness. This is a topic that was brought out as part of the polyvagal theory by Dr. Stephen Porges, who is absolutely brilliant and also happens to be a neighbor of Dr. Stott's, I believe. So, this is a concept that really needs to be understood. Safety, for me, is the key to understanding how psychological stress works. So, this constant question is being asked in our brains subconsciously of, am I safe? And the answer to this question is always going to tell us what state our body should then correlate into or go into. When we're in a neuroception of safety, this is the bottom area here. This is a kind of a version of the polyvagal theory here. When we're in a state of safety, we turn on our parasympathetic nervous system and our vagus nerve is working quite well. When we feel safe, we feel capable. So social engagement, affiliative behavior, productivity, and rest and digest tend to work very, very well here in this particular area. And this is what we call sustainable physiology. Physiology that allows us to be sustaining in our life pattern. There are moments, obviously, as we increase in our neuroception towards danger. Danger is where we get into a state of social survival, appeasement, conflict behavior, and conflict avoidance behavior will often become uh, very common here. And this is where we'll notice that people are in fight or flight. They're fidgeting, they find or flock, they tend and befriend. They flatter, fraternize, and are funny, and they fib. They tend to lie a little bit more here, and they conceal their own guilt. There's almost a feeling of shame here. But this is when we're in the neuroception of danger. And this activates survival physiology, specifically turning on the sympathetic nervous system and getting us into sympathetic activated state. This is pushing the gas, the accelerator in the car. There are moments where we go into a state of terror or overwhelm, and this goes into shutdown state. And when we're here, we're in freeze state. Okay. The best analogy I can explain here is the deer in the headlights mentality, where the deer sees the car coming, the headlights are very clearly there, but the target or the deer in this situation is unaware of what to do, doesn't understand that the headlights coming towards them means that there is threat to their survival, and they don't know what to do about it, so they freeze. And this is where we go into a state of conservation physiology, and we turn on the brakes, but the brakes are pushed as hard as possible, so people are frozen in this state. This is like severe depression, severe anxiety, very fragmented, very faint, very frozen experience. It doesn't happen too often, but when it does, it's severe and needs to be managed in a very particular way. In this area, I just want to point out that when people are in the neuroception of danger, this is where I feel that vagus nerve stimulation works very, very well. Okay. I don't love it when they're out in shutdown state because they're generally hypersensitive or incapable of handling things. But when you notice that people tend to be a little bit more jumpy, a little bit more fight or flight, fidgety, they're lying a little bit or they're fibbing a little bit, this situation is that neuroception of danger. They don't feel safe. And vagus nerve stimulation in this area works very, very well in my experience. Okay, so just an important one to look into. The next area is physical stress and movement. I believe that movement is life. So I really want to know from my patients, are they moving their bodies effectively? Are they sitting in their office chair for 8 hours a day and then they're sitting in their car for an hour each way? And then are they sitting on the couch when they get home? That's a real sign that they're not moving effectively or enough. We also want to note if they're overdoing it, right? Repetitive strain injury can be a bit of an issue as well. So we really need to look at movement patterns and optimize for being in a state where they're moving enough but not too much and recovering well from a physical standpoint as well. So movement is very, very important to look into. Assess and address their movement patterns. If you're a hands-on practitioner, you can do this probably very well. I love addressing fitness levels as well, physical capacity, injuries, injury severity. One of the areas that I think needs to be looked at is there an injury history specifically around concussion, TBI, or whiplash? Because these issues are direct effectors of the brainstem where the vagus nerve attaches into. We know that the vagus nerve attaches to the brainstem specifically at nucleus tractus solitarius and the dorsal motor nucleus of vagus. That's the primary nuclei of the vagus nerve. And any force or any trauma in a longitudinal pattern or in a TBI style pattern tends to have a shearing effect on the brainstem at the area where the brain enters the brainstem, because we have a very solid spinal column holding the brainstem, but the brain above is quite mobile within the head cavity, within the skull. So what that does is it creates a shearing force when there's a whiplash style injury or a TBI type injury. This is important to look at because injury severity here in this situation can directly develop into autonomic symptoms. Autonomic concussions are one of the major sources of concussion, and we all often see autonomic dysfunction following that type of injury. Look into muscle strain, muscle tension, and joint mobility as well. If we can be moving optimally, then our bodies don't feel stressed, right? Even if anybody's ever experienced having a rib out or a low back joint lockup, that is not something that allows you to feel like you're out of the feeling of being strained. You're stressed when your back is hurting. You're stressed when you can't take a deep breath effectively. So these are important things to look at from a physical stress perspective. That movement piece is very important. Now, the last one, and this is where functional medicine does really well, is biochemical stress, looking at the environment, internal and external environment. Hippocrates famously said that all disease begins in the gut. This is huge because this is where all of our toxins enter. This is where all of our food enters. Our nutrients generally get in through our gut. It is the most important uh, interface that we have with the outside world, and yet it's also where the most toxins can enter. So we have to look at internal toxins, the presence of internal stressors such as dietary and nutrient depletion, pesticides, microbiome dysbiosis is very important. On the external side, mold, uh, toxic pollutants and indoor air quality issues, fine particulate matter, PM 2.5. These are those tiny fine particulate matter that need to be addressed from a biochemical stress perspective. And these are all going to push our bodies into a state of feeling biochemically and physiologically unsafe. Assessing root causes through functional lab testing is something that we do, and I think can be very beneficial if you're able to add it into your practice. Nutrient and dietary testing through urinary organic acids, microbiome assessments through stool analysis, and environmental inflammatory triggers, things like mold, heavy metals. Make sure that these things are not present in your patient's environment when you're dealing with this. So I want to take us back quickly to this tree that we remember as being the the tree that when we're looking at it from Western perspective or from a disease focused only perspective, we just see the branches. We just see the label that's been given. When we look from a functional perspective, we see all of these root causes. And I've classified those root causes into those four areas. But there's one missing piece to this, and that is the trunk of this tree. The trunk is the connecting point. There's a single trunk between all root causes and all disease states. And that single root trunk area, that single piece that's missing, is uncontrolled inflammation. And this is where the vagus nerve is really very important, because when we have all of these root causes pop up, they result in some form of inflammation. And when that inflammation is uncontrolled, that's when we head into disease state. So why the vagus nerve? Well, the vagus nerve is the linchpin of the cholinergic anti-inflammatory pathway. Vagus nerve insufficiency is linked to many health conditions. Now, the vagus nerve I mentioned attaches into the brainstem at these two very important nuclei, nucleus tractus solitarius, dorsal vagal motor nucleus. So we've got the afferent, 80% of the vagus nerve is afferent, coming up from the organs up to the brain, and coming into the nucleus tractus solitarius, having its relay points internally, and then having efferent signals come down through the nerve directly to some tissues, such as the lungs, such as the gut, and indirectly to the spleen. And the effect is to turn on the beta 2 adrenergic receptors on these T cells, activating these T cells that are known as CHAT cells, choline acetyltransferase specific CD4 plus T cells, which then go out and release acetylcholine. And acetylcholine is the only neurotransmitter that is utilized by the vagus nerve. Acetylcholine goes and attacks or attaches to the alpha 7 nicotinic acetylcholine receptor present on all immune tissues, most importantly, the local tissue macrophages and splenic macrophages. And what it does is it downregulates the inflammatory cytokine activation and shuts down the inflammatory process. This is really where the linchpin to this entire system is. When the vagus nerve is dysfunctional or insufficiently functioning, then we result in a lot of these chronic health conditions, gastrointestinal conditions like gastroparesis, IBS, IBD. Cardiovascular conditions are common, are arrhythmia, hypertension, dysautonomia, chronic fatigue, cognitive and mental health issues, autoimmune conditions, respiratory disorders, and chronic inflammation all are linked directly to vagus nerve insufficiency. This is important for us to all look at. And this is where cervical transcutaneous vagus nerve stimulation can really come in and provide some insight and some support to the vagus nerve. Electrical stimulation of the vagus nerve fibers along those areas in the anterolateral cervical spine area. If you find your pulse, you found your vagus nerve within a few millimeters. What makes that so beneficial is it's so easy for patients to find. Once they're able to understand where they have to go to find their pulse, I get them to push their head into their hand, pop up their SCM muscle, and just put their fingers just in front of that. And right there where they feel their pulse, that's as close as you're going to get to the vagus nerve. And then we can place our device directly onto that area as easily as possible. It's easily accessible within the carotid sheath, directly beside the carotid artery and the jugular vein. The activation helps both afferent and efferent axonal fibers here in the neck. It doesn't happen the same way in the ear or anywhere else. There's also just important note, there's 100,000 or so fibers on the left side and a little more than 200,000 fibers on the right side. So we're getting a lot of vagus nerve fibers, vagal axonal fibers when we hit it cervically versus when we hit it in other areas. So this is really important to look at. How does it work? Well, this is an fMRI study showing that when you stimulate directly on the carotid sheath in the correct areas, we're getting direct activation of the nucleus tractus solitarius and dorsal motor vagus nucleus. Okay. You're also going to get a little bit in the vestibular nuclei, medial longitudinal fasciculus, and you're actually going to inhibit activation of the spinal trigeminal nucleus, which happens to relay a lot of pain information as well. So really important to note there. The effect of it is in a biphasic response, as shown through this fMRI study, that in the early phase, there's inhibition in certain areas in the frontal cortex, calming and activation of the raphe nuclei and substantia nigra. Then we get some activation in a very important area of the thalamus, which shows up as being very important here. We've got a lot of the ventral tegmental area, the periaqueductal gray, and the dorsal raphe nuclei also getting activated. And that continues on late into this third phase or into the biphasic response where we get this inhibition and calming in the thalamus, as well as activation again in the brainstem. So really important to note how it functions. It takes a little time for it to relay in, but you'll often hear 15 minutes after they've done their stimulation, oh, I feel really calm. I feel really good. So this is why I really like it, because it's a very quick acting tool in helping people feel this good. The effect of this is also to note that it's going to change the shape of macrophages. It's going to change how they function. When we're in an inflammatory state, inflammatory inputs such as lipopolysaccharide or IFN gamma turn macrophages towards M1, which are pro-inflammatory, and I like to call them the fight macrophages. When we have anti-inflammatory cytokines, IL-4, IL-10, for example, this shifts them towards M2 macrophages, which I like to call the fix macrophages. We need to have both present, but we need to have a balance most of the time towards the fix macrophages, because if we have too much fight, we're going to break down tissue too easily. Now, what's really awesome is when we have a lot of M2 macrophages, we're able to inhibit these M1 macrophages. And there's actually a way to shift from M1 to M2, and that is through acetylcholine and vagus nerve stimulation. The way that this works is when we stimulate the vagus nerve here, we get activation in all of those very important brain areas that we spoke about, locus coeruleus, the raphe nuclei. We get activation of the acetylcholine, norepinephrine, and 5-HT into the cerebrum. And the very important area that it's going to affect, in addition to areas that manage emotion and manage memory, amygdala and hippocampus, we're going to get improvements in executive function in the cortex, and we're going to have very important improvements in the thalamus. And this is where I want to talk about where to decide to use vagus nerve stimulation, because these are the areas that are most commonly affected and most improved when we're working with our patients and using vagus nerve stimulation. So here are the top 3 questions that I ask when I'm deciding what to use to help make this decision. Number 1, do you have trouble falling asleep or staying asleep? Okay, very important question to note. Sleep is going to be number 1. When sleep is dysregulated, that's my number 1 deciding factor to use it. Number 2, do you have difficulty thinking clearly or regulating emotions? So brain fog, lack of memory optimization, having difficulty remembering words, remembering where you parked your car. Or do you have difficulty regulating your emotions? You get hyper emotional very quickly. Or is there some sort of mental health type of challenge happening here, depression or anxiety potentially occurring as well? And lastly, do you have issues with gut or bowel function? So these 3 questions help me determine if this person's going to likely be a good candidate for VNS. Now, number 1 is dysregulated sleep, no question about it. Optimal sleep architecture looks like 5 cycles of these drop downs between awake state, REM, N1 and N2 being the light sleep area, and N3 being deep sleep. And we drop through these cycles optimally 5 times through the night with minimal awakenings through the night. Okay. For most people, it takes between 7 and 8 hours to get those 5 cycles, which is where those 8 hours kind of came from. But some people have shorter cycles, some people have longer cycles. So note with your patients, and this is where I find that utilizing wearable data can be very beneficial in noticing how many cycles they're going through, what percentage of the time is being spent in each of these areas. This is really important. So this is actually one of my best nights of sleep that I got to go and take screenshots of. Got 7 hours and 49 minutes of total time of sleep. I was in bed for 8 hours and 20 minutes. I went to bed a little early, 9:54. I woke up at 6:14, and you'll see 1, 2, 3, 4, 5 sleep cycles happening here, which is very, very optimal, especially this night. My kids didn't wake me up. I also noted that only 31 minutes was spent awake total out of that full sleep time. And I was in REM sleep for 22% of the time, an hour and 44 minutes. In light sleep for 53% of the time, 4 hours and 8 minutes. And in deep sleep for nearly 2 hours at 25%. The optimal goal, if somebody's utilizing wearable data or wearable sleep trackers, you want to be 25, 50, 25. 25% REM, 50% light, 25% deep. Okay, that's optimal. It doesn't happen often, but it's a great one to look for when you're working with your patients. Why this matters when it comes to the vagus nerve is very clearly chronic recording of the vagus nerve to analyze modulations in the light dark cycle. The moment we fall asleep, vagus nerve activation occurs. The moment we wake up, vagus nerve shuts down a little bit. We go into a sympathetic state when we're awake. We need to be asleep. We need to be in a state where vagus nerve is able to turn on, and we follow a very strong circadian rhythm. Vagus nerve activation follows this. The letter C here is ENG of the vagus nerve, specifically showing spike activity over a 48-hour period. And it was a very clear pattern that vagal spikes occurred less during the day and significantly more during the night. But the moment they fell asleep, it was like the light switch went on and the vagus nerve was able to turn on. Okay. That's very important to note. So light dark cycles strongly affect vagus nerve. That's why I'm wearing my blue blocking glasses right now, because I'm doing this before I go to bed and I want to make sure that the light doesn't affect me too much. There's a lot of different conditions that are associated with sleep deprivation. We know this. This is not new information to anybody, but if we're not getting sufficient sleep, cancer, infection, neurodegeneration, cardiovascular disease, all are strongly linked to sleep deprivation. Lastly, I just want to point to this very cool study showing that transcutaneous vagus nerve stimulation could improve the effective rate on the quality of sleep in the treatment of primary insomnia. This was really great because it showed that VNS was effective for primary insomnia patients, and that treatment had also significantly relieved the level of anxiety and depression assessed by HAMD and HAMA scores. So there are several studies that have shown that VNS can improve sleep quality in patients with primary insomnia. And there's an RCT demonstrating that VNS effectively enhanced sleep quality with a significantly higher success rate compared to the control group. VNS was found to increase the number of periods in the REM phase, prolong the REM phase, and extend total night sleep, especially the second stage sleep time. Very important. We get more deep sleep in those first two stages, the first two cycles. So very important that those first 2 or 3 cycles are long enough to enable deep sleep to occur. So here's a quick little protocol for anybody who's dealing with sleep challenges. This is the protocol that I utilize to help them manage their sleep issues. So I have them keep their device either on their bedside table or in their bathroom sink. Brush your teeth, do your stim, or do your stim beside your bed. So in the morning, 2-minute stimulation upon waking helps with the wakening response, helps with managing cortisol levels as needed in the midday and evening stages generally, but I'll increase the stimulation time and number of stimulation sessions between 2 and 3 2-minute stimulations as they're getting into bed. So really helping to turn the vagus nerve on as they're entering that state of getting to sleep. This is also very effective for people that are doing shift work. Shift workers love utilizing this to help to get them into that regulated sleep pattern, and also phenomenal for jet lag. And I know because I travel quite a bit and I use mine when I'm traveling to make sure that I can stay awake when I need to stay awake and get to sleep when I can get to sleep. And nothing is going to be 100%, but it helps me recover more effectively when I stimulate while I'm traveling. So really important one to look at. The second one is dysregulated cognition or emotions. Now, we know that there are many clinical correlations that we need to look at that are linked to vagus nerve dysfunction in the mental health space, depression, anxiety, post-traumatic stress. In the cognitive health space, brain fog, dementia, neurodegeneration overall, autonomic nervous system and relationship among heart rate variability, stress coping, and cognitive ability in individuals with psychiatric disorders showed patients with relevantly elevated depression scores had significantly lower HRV and improper self-reported abilities to cope with negative emotions and stress. Additionally, a lower HRV was related to higher values for the upscale of self-reported negative stress coping. This relationship is fully mediated by depression severity. So severity is a big thing when it comes to this. We know that the microglia are these tissue-resident macrophages that are present and activated in every single one of these neurodegenerative, cognitive, and mental health disorders. And when they're activated, they're turned into that M1 fight state and they're active for way too long. And they cause that damage to be prolonged and progress. So this is a huge piece to the puzzle. Well, here's a really awesome study showing that vagus nerve stimulation actually changes the morphology of these microglial cells. Vagus nerve stimulation can promote M2 polarization and inhibit M1 microglia polarization via inhibition of the toll-like receptor 4, NF-kappa B pathway in microglia. VNS promotes microglial M2 polarization through upregulating alpha-7 nicotinic acetylcholine receptor to reduce neuroinflammation. And this one was amazing. It showed morphological changes in activated microglia may be directly reversed by VNS. Literally stimulating the vagus nerve has been shown to change the shape of these microglial cells from what resembles an M1 macrophage to what resembles an M2 macrophage or microglia cell. So this is huge to note that when we do this, we can alter the shape of and the activation of these microglial cells to help resolve a lot of these challenges. A great prolonged study here showed that vagus nerve stimulation in major depression, the VNS arm was approximately double that in the treatment as usual arm. So double the number of first-time responders, and first-time remission doubled as well. Patients in the VNS arm were significantly more likely to experience remission than those in the treatment as usual arm. So they did treatment as usual, and then treatment as usual plus vagus nerve stimulation. The patients in the VNS arm had significantly more positive outcomes in response rate, time to response, and duration of response, while also experiencing reduced mortality and suicidality. This study speaks for itself. I love this. It's a 5-year study showing how many cumulative patients and percentage of patients experienced response and remission when utilizing vagus nerve stimulation in conjunction with their care protocol. So here's the protocol that I've begun using with my patients for improvements in cognition and mental health. And that is keeping their device in their work bag or in their purse in the morning, 1 minute or 1-2 minute stimulation upon waking, in the middle of the day to help them maintain good cognitive function through the day, 1-2 minute stimulation session around lunchtime is what it's supposed to say there. In the evening as needed, and then before sleep, getting back into that sleep routine. 2-2 minute stimulations works really well as they're getting into bed, and it helps with that full recovery at night, active during the day routine. And people tend to find improvements in cognitive function with that. And we know that there's a strong correlation between mental health issues and sleep dysregulation as well. Now, the last area that I want to look at is dysregulated GI function. We know that there are many functional gastrointestinal disorders that are linked to vagus nerve dysfunction. Anything from gastroparesis to IBS, IBD, leaky gut syndrome, SIBO, all are linked pretty heavily. Significant differences between IBD and healthy controls in time domain HRV, and significant decreases in high power measures were also noted in both IBS and IBD compared with healthy controls. So we know that there's a vagal component or an autonomic component to this. Well, when we add vagus nerve stimulation into gastroparesis cases, this is a great study showing that short-term treatment, just 3 weeks with NVNS, alleviates the cardinal symptoms of gastroparesis in a 3-week proof of concept study. Improvements in nausea, postprandial fullness and early satiety, as well as bloating. Now, not every patient was a responder. This is across the board, right? Not 100% of people are going to experience it. Maybe something was going on from a microbiome dysbiosis perspective. Maybe there was actual injury to the vagus nerve that was incapable of being stimulated at that point. But when they did respond, they respond very, very well. Between 35 and 50% improvement in these symptoms in just 3 weeks of stimulation. In intestinal hyperpermeability, famously known as leaky gut syndrome, VNS prevents ultrastructure injury in endotoxemic mice. Stimulation of the vagus nerve improves intestinal tight junction protein expression, and it inhibits MLCK and NF-kappa B, which are the molecules responsible for intestinal tight junction breakdown. In inflammatory bowel disease, VNS prior to DSS exposure improves colitis by reducing apoptosis and promoting epithelial cell proliferation. This is the prevention piece, helping to make sure that it doesn't occur or it's less likely to occur. During the DSS-induced colitis, VNS treatment improved body weight and disease activity, and VNS during DSS-induced colitis controls innate immune cell influx, how many macrophages are entering the cell, and thus dampens the immune response in inflamed colonic tissue. So when it comes to GI issues, I have a gastrointestinal protocol that I use, and this is basically aligning it with your meals. 1 to 2 2-minute stimulations with your first meal, 1 2-minute stimulation with lunch, and 1 or 2 2-minute stimulations with dinner. I like to add it in because remember, we know that the vagus nerve parasympathetic activation is rest, digest, and recover. We need to go into that parasympathetic state to enable the digestive system to work, to get the food in, to allow the nutrients to work, for peristaltic motion to be initiated in the gut. So this is a very important piece to that puzzle when it comes to how to optimize for gastrointestinal health issues. There is a bonus here, and that is if you come across a patient that has chronic uncontrolled inflammation. These are often going to be people that have high HSCRP levels, ESR, mast cell activation, or is high eosinophils on blood work, low HRV on wearable data, autoimmune or inflammatory condition diagnosis, and if their wearable device data shows high stress levels, high heart rate, inability to recover following stressors, or the inability to come down, this is a great time to consider utilizing VNS for inflammatory control. And when it comes to inflammatory control, there's a protocol that I use here, and this is the most aggressive of the bunch. 2 2-minute stimulations in the morning, 1 midday, 1 evening, and 2 2-minute stimulations before bed. Remember, the FDA has cleared up to 24 stimulations daily, 2 2-minute stimulations daily on the electroCore device. So utilizing it this aggressively is not getting anywhere near that amount. Now, of course, you want to be very particular with each patient that you're utilizing this with, to how sensitive they are, to how capable they are to handle it. Obviously, be really, really conscious of individual use patterns and how to do this. So I'm never going to say that the protocol is the way to do this. I just want you to note this is how I'm utilizing it, but I'm always adapting it to every single patient on an individualized basis. Okay. I have patients that if they stim before bed, they can't fall asleep. So I have them do it early in the day and midday, and that's it. We don't do it before bed, and then they tend to get very good sleep. And then they're awake and energized in the morning. There's other patients that just use it at night to help with sleep, and that works very, very well for them, and that's how they utilize it. So be really particular about this. Protocols are a starting point. They should absolutely not be a prescription for all of your use in every single case. I want to end with a couple little things here. Number one, activating the vagus nerve facilitates a state shift from sympathetic fight or flight to parasympathetic rest, digest, and recover. The most important thing that I can share with anybody out there is that our bodies cannot heal when we're stuck in fight or flight. Healing can only happen when we are able to enter a parasympathetic state. And that's why I wrote my books, and that's why I have my podcast. Peter Stotz was one of my wonderful guests. We got to talk about how vagus nerve stimulation in its non-invasive form came along and how they were able to create that. And I want to give one final little plug to the Vagus Nerve Society. I highly recommend, if you have not yet joined, or if you have a friend who you think could utilize this information, get them to sign up for the Vagus Nerve Society. You can go to vnsociety.org, or you can simply scan the QR code on this slide. All right.